This was my understanding of health as a kid. When I was sick or injured, I didn't feel well, I couldn't play with my friends, it was lame. And then I'd get better, and I could play again, and all was well with the world. It was that simple. Now, starting in high school, my understanding of health got a little more complicated. I was absorbing all this information about nutrition, fitness, obesity, health risk, so I decided to make some changes. I started exercising more, eating certain foods, not others, counting calories, eating smaller portions, and I lost weight. In the process, I received probably equal amounts of praise and concern. I chose to listen to the praise, downplay the concern. After all, I knew what I was doing. I was being healthy. I suppose my hair was falling out, my fingers were turning blue, hunger kept me awake at night, I couldn't focus in class, and I lost my period. But this must be what healthy feels like. After all, I was doing all the things that healthy people do, and I was that fit, lean sort of look that everyone says is supposed to be healthy. Now, during this time, I was constantly thinking about food, so I decided to study nutrition and become a dietitian. That way I could help other people be disciplined about their health, like me, and I could think about food all the time. So when I started this work, I initially was seeing people for eating disorders and weight management, and I became a dietitian. And I knew that the learning curve would be steep working with eating disorders. I didn't have a lot of training, but I had no idea how much I would truly learn. Not only by working with eating disorders, but having weight management side by side with eating disorders. Now, I wanted to specialize in weight management, so I was seeing a lot of people for that. But having these groups side by side really forced me to see some things I had no idea that I would need to see. For example, I had an undiagnosed eating disorder in high school. Also, my views of health were kind of messed up. And my dream career was going to have to change. I had these big dreams of ending the obesity epidemic, one school and corporate wellness program at a time. Well, that dream did not last long. It didn't make it through this first job. So I'm here to share with you today why I decided to approach health differently for my clients and how I learned to do that. And I learned these things in my first job, so I'm going to share with you what I observed. First, my eating disorder clients were looking the same as my weight management clients, often, in terms of body size. So I was seeing people who were thinking and behaving exactly like a person with anorexia nervosa. They just happen to have a normal size or larger size body. So this is called atypical anorexia, and it turns out that atypical anorexia is actually more typical than the classic underweight anorexia. So it makes sense why I was seeing a lot of people like this. At the same time, I was getting referrals for weight management, and when I'd see some of these folks, their doctors would refer them, I learned that some of them were actually relatively healthy. They were fairly active, they were eating relatively balanced, but I suppose we were managing their future risk of disease by focusing on their weight. And then I was also seeing people who were underweight, who were very sick, so I started to question whether I could make any assumptions about a person's health, their needs, or their behaviors based on their weight. Another thing that I recognized is some of my weight management recommendations were actually fueling eating disorder thoughts and behaviors. I want us to take a look at dieting. Pretty classic stuff. Eat less calories or less food. Sometimes this involves eating certain foods and not others. Exercise more. Keep tabs on your weight or get weighed at your dietitian appointments. And then the part nobody wants to talk about. When you inevitably fall off the wagon of your diet plan, or as I was calling it, your lifestyle goals, then you shift into the opposite direction, the screw it plan, and you feel really ashamed. Maybe stop coming to your dietitian appointments. That often happened for me. Now let's take a look at eating disorder behaviors and mentality. Now, I'm wondering if you can see how similar these two things are. Sure, the eating disorder side is the more extreme version, but they're not that far different. Now, when my eating disorder clients were engaging in dieting behavior, we called that disordered behavior. After all, if we really think about it, dieting behavior is not normal. It's not normal for us to intentionally eat less than our bodies need. That doesn't come natural to us. It's not normal for us to exercise through exhaustion. We definitely don't like doing that. And it's not normal to feel ashamed about eating. I mean, eating is so fundamental to living, it's like breathing. So as I was observing these things, then I started to think, I wonder if actually normal eating, disordered eating, and eating disorders fall on a spectrum. I don't know that they're as clearly defined as we think they are. Well, this question was answered for me in a really uncomfortable situation. One of my early clients that was referred to me for weight management by a doctor, I started recommending, nutrition and fitness goals for this person to support them in their weight loss. Well, it turns out this person ended up meeting criteria for an eating disorder. It was horrible. Could you imagine starting making, certain recommendations and then you completely backtrack and say, actually, you need to accept your body where it's at, relax on the exercise, and eat more food? I mean, at best, I was being contradictory and ignorant, which I was. But also, I knew I must be causing harm to this person by giving such mixed messages. So by this point in my first job as a dietitian, I'm panicking. I'm like, I have no idea if I know anything. I'm adapting along the way to try to figure out how to support these clients. And my approach with both groups started to become more and more similar. Then the gap between them in my mind became smaller and smaller, weight management and eating disorder. And I also noticed that there was this common theme running through both groups that really connected them. That was fear. Fear of food, fear of fitness, fear of our bodies. Out of fear of not eating right, we forget how to eat. Out of fear of not exercising right, we engage in exercise we don't even like, or we don't do it at all because we're not doing it right. Out of fear that our bodies are or will become a burden to society and doomed to an early death, we set out to make them smaller or keep them smaller by whatever means necessary. One study found that around 2/3 of young women and teenage girls are actively dieting, and 1/3 of teenage boys. Another survey found that around 50% of teenage girls are engaging in crash dieting, fasting, self-induced vomiting, laxatives, or diet pills. Does that sound healthy to anyone? You want to hear the worst part? 95% of dieters will regain their lost weight in 1 to 5 years. You heard that right, 95%. We are obsessed with dieting, and it's not even working. Now consider this. Are we failing at dieting, or is dieting failing us? Well, a $60 billion diet industry will have us believe that we are to blame. We just haven't found the right miracle product or program yet. And our healthcare providers tell us similar things. You just haven't tried hard enough yet. Or send us home with the same nutrition and fitness handouts. So is this all really about our health? Well, we can take a look at that. The World Health Organization defines health in 3 categories: physical, mental, and social. They're all important, and they're interconnected. So when one is impacted, the others are often impacted. We can take a look at the county health rankings model, which tells us all of the different factors that impact our health. This model is based on data that's been collected from nearly every county in the United States. And it includes percentages to show us to what degree each area or each factor is associated with our health. Now, I want to point out the health behaviors section, 30%. So this includes diet and exercise, as well as drug, tobacco, and alcohol use, and sexual activity, suggesting that less than 30% of our health is likely connected to diet and exercise. But our world loves to focus on health, focus on diet and exercise for health and our weight. So much so that it seems as though we lose sight of the other factors or the other areas of our health. For example, let's talk about the stress of navigating diet culture. By raise of hands, how many of you remember when dietary fats were making us all fat and unhealthy? Raise your hands. Yeah, I grew up with that. Well, now it's carbohydrates and fats are fine. Oh, the dietary guidelines tell us that fruits are good for us? No way, way too much sugar. But juice cleanses are great. I mean, this is absurd. Of course it's stressing us out trying to figure out what the heck do we eat? I know far too many people who would rather avoid certain situations, such as spending time with grandma or hanging out with friends in the dorm, because they know, or they're fearful, that grandma is going to tempt them with her famous homemade pie, or that the main entree at the dorm party is pizza. Of course, this is affecting our social health and our mental health, and it's connected to our physical. Others feel deep shame when they cannot keep up with their fitness goals or their nutrition goals or their weight loss goals because life got in the way. Some of us are just trying to survive. Maybe a family crisis happened, mental health gets in the way, stable income, stable housing. I don't think we can any longer ignore that our obsession with weight, nutrition, and fitness gets in the way. Our health is so much more than what we eat, how we move our bodies, or the number on the scale. Now, I feel healthiest going on a walk to clear my mind, being creative, spending time with my family, finding purpose in my work. Because I have taken a look at what health means for me individually, I have realigned my priorities so that a much smaller and more realistic portion of my time and energy is taken up by nutrition and fitness, which has allowed me freedom to explore the other areas of my health. It's helped me to find more balance. I want to empower this for each of you. If you feel that food, fitness, or your body, fear of all of those things is getting in the way, taking up too much of your time and energy, it doesn't have to anymore. There are entire movements of people who are supporting a different picture of health. When I found Health at Every Size and intuitive eating, everything fell into place for me. It was incredible. There's like this whole community of people who know a different perspective on health. They could validate my personal and professional experiences and give me tools and science to show there's another way to think about this. For example, the Health at Every Size community argues that intentional weight loss actually leads to weight cycling because it's not sustainable for most people long term to actually keep weight off. And weight cycling is a separate risk factor for poor health and weight gain. They assert that bodies are supposed to be diverse. We're supposed to have different size and shapes bodies, just like we have different hair colors and heights. And we always have. The Health at Every Size community distinguishes that a correlation between weight and health is not the same as causation. Just like we would never suggest that smoking causes lung cancer, because we know that that yellow teeth causes lung cancer. We know that smoking causes both. Why would we then suggest that weight causes health problems when we know that so many other factors impact both? A study done here at Purdue University in 2011 by Dr. Marcus Schaefer evaluated the impact of weight stigma on a person's health. He found that those who experienced more weight stigma actually perceived themselves as bigger than they were and had worse health outcomes. Are we considering that in the association between weight and health? So let's say you're considering maybe my weight or concerns about nutrition and exercise are not as important as I think they are. What if I'm trying to approach things differently? That's where intuitive eating comes in. It's a non-diet approach to eating and moving that is better, it's attuned to our individual bodies. So it helps us to break free from that diet-driven, mechanical, emotional eating and exercise. And instead lets us tune in to what, when, and how much food and physical activity actually aligns with our physical, mental, and social needs. It's considering the whole health picture. Health at every size and intuitive eating are empowering approaches. From these perspectives, all bodies are worthy of care and compassion. More people, including healthcare providers, are turning to health at every size because it just makes sense. Maybe I say that a little lightly. Of course, it doesn't just make sense when most of us have been conditioned to think very different things about bodies and health. I just happen to be primed and ready to hear a new perspective because my personal and professional experience had already punched giant holes in the fabric of my understanding of health. I also had less to risk because when I stopped worrying about controlling my weight, my body still settles as a relatively small person. And the world is kinder, unfortunately, to smaller people right now. It was still really hard for me to challenge my education and confront my biases. So I truly understand if some of you are ready to hear my message today, and some of you definitely aren't. I really get it. All I ask for is curiosity. Get curious about these ideas. Maybe even consider baby steps. Something like, what would it be like to just spend time with my grandma, learn her recipe, and enjoy her pie with her? Or hang out with my friends and eat pizza and set the guilt aside. Sounds pretty great to me. Thank you so much.